Hello again, my name is Janak Goyal and I'm a rheumatologist, and in this presentation I will talk about the scanning techniques of elbow joint. The examination of the elbow is conducted from four different views: anterior, posterior, lateral and medial. This systematic technique of elbow examination is for learning and teaching purpose only. The examination of the elbow is focused to the structures based on the clinical impression. For the examination of the anterior elbow, patient is either seated or supine with the arm extended and the hand supinated, and the examiner is sitting on the side of the patient. I usually start the examination on the transverse orientation of the transducer about 5 centimeters above the elbow joint and scan distally perpendicular to the shaft of the humerus. And as I go along, I would like to examine the structures from proximal to distal. What I will be seeing as I'm scanning, I'm seeing the biceps is the most superficial, and then seeing the brachialis, and then seeing the capitulum and the trochlea of the lower end of the humerus. And here on this picture, what you're looking at, here you're looking at the capitulum, and here is the capitulum, and here is your trochlea, and your trochlea is under the brachialis. You're looking at this is main bulk of muscle which is formed by brachialis, and the biceps lying superficial to the brachialis. And also you will examine the joint capsule, which is a hyperechoic structure lying just above this little hypoechoic cartilage of the lower end of the humerus. Let's look at the longitudinal view of the anterior elbow. You'll be looking at two separate articulations when you're looking at the longitudinal view of the anterior elbow. The one is the humeroradial articulation, the other is the humeroulnar articulation. Where you're looking at the humeroradial articulation, sweep your transducer on the anterior lateral aspect of the elbow, either from proximal to distal or from distal to proximal, to see the entire extent of the humeroradial joint. What you'll be looking at while you're looking at the humeroradial joint from proximal to distal, you'll be looking at the radial fossa, capitulum, radial head, and the annular or periradial recess of the elbow joint. Then on the ulnar side, what you're looking at when you're sweeping your transducer from proximal to distal or from distal to proximal, again you'll be looking at the structures from proximal to distal. You see the coronoid fossa, trochlea, coronoid process, and the attachment of the brachialis muscle right in front of the coronoid process. The examination of the biceps tendon, the distal biceps tendon, needs a significant amount of practice. But you will be putting your transducer along the orientation of the biceps tendon and using a heel-toe maneuver to look at the distal attachment of the biceps tendon. If you have an issue with the examination of the biceps tendon, you could shift your transducer a little bit on the ulnar side and tilt it in the direction of the biceps tendon to examine it. But again, it will need a lot of practice to see this tendon. We do want to see the distal attachment of the tendon where you're trying to examine, and this is what you will be seeing. Here is your radial head, here is your attachment of the biceps tendon coming the superficial to deep as it travels. For the examination of the posterior elbow, patient could either be sitting with the arm flexed to 90 degrees and the palm placed on the thigh as shown in this image, or alternatively the patient could be supine and with the arm placed on the abdomen, and the transducer is placed on the posterior aspect of the elbow just above the olecranon in a longitudinal view this is what you will be seeing in your image. You see your olecranon fossa, here is your trochlea, and here is your olecranon process, and the triceps tendon getting attached to the olecranon process. And if you look into the drawing here, here is your triceps muscle and the tendon and attaching to the olecranon process. And deep to that, you see the olecranon process, and you will see the olecranon fossa. On the transverse view, again, you are placing your transducer just above the olecranon and in a transverse view. And here is your triceps tendon. You are placing the transducer in a transverse view. You will see a kind of cup-shaped pit, which is your olecranon fossa, and with the fat pad sitting in there, and you have your triceps muscle and tendon sitting superficial to that olecranon fossa. Let's look at the medial side of the elbow. What you're looking on the medial side of the elbow, the structures which are important for examination is the medial epicondyle, right here. Here's the medial epicondyle, and the attachment of the common flexor tendon to the medial epicondyle. Here is the attachment of the common flexor to the medial epicondyle. And then the other structure you're looking here is the medial side of your trochlea, and here is the medial aspect of your coronoid. And here are the positions of your transducer. This is how you put a transducer on the longitudinal view for the view of the medial epicondyle. Let's look at the short axis view of your medial epicondyle. Again, the structures are the same, but this is the view which we want to look at. What you're looking at here, the structure here is your medial epicondyle. And if you compare that, this is the medial epicondyle. And right here, the part of the bony landmark which is dipping is the medial side of your trochlea, which you're looking at. And you're looking at the ulnar nerve, which is passing posterior to the medial epicondyle and right on the medial side of the trochlea. This is where you're seeing the medial epicondyle, medial side of the trochlea. Here is your ulnar nerve, and here is the whole process of the trochlea. Then you're seeing next structure is the olecranon process. Here is your olecranon process, which you're seeing in this image, and here are your transducer placements for obtaining this image. Now you may be interested in looking at the longitudinal view of the ulnar nerve, which is right here. I have seen that most of the time people have a difficulty of examining the ulnar nerve. The trick of examining the ulnar nerve is, look at this ulnar nerve. Ulnar nerve is passing right posterior to the medial epicondyle and then crosses to the anterior aspect of the forearm and going on to the anterior aspect of the ulnar head. But the mistake is, a lot of times people will try to look at it, they put a transducer in this orientation, because if you put a transducer in this orientation, you will not see it. So the thing is, you try to find your the posterior aspect of the medial epicondyle, place one of the transducer there and orient your transducer anteriorly towards the Guyon's tunnel, and you will see a beautiful image of the ulnar nerve right away without any problem. Here is the orientation of your transducer. This is how you have to place your transducer. Not this way, this orientation. And here is the orientation on the patient. Now let's look at the lateral side. A lot of times we're interested in the lateral aspect because everybody knows about the tennis elbow, which is the tendinopathy of common extensor tendon. Now here is your lateral epicondyle. Here is the head of the radius, and here is your common extensor tendon, the whole group which is attached right here. This is your extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris, which are the components of your common extensor tendon. When you're scanning, what you need to do is you need to place your transducer one end on the lateral epicondyle and direct it towards the posterior aspect of the forearm, particularly towards the radial styloid, where you see that your extensor carpi radialis brevis, and you will see this tendon which is clearly attached right here, attaching to the lateral epicondyle. Then you see the here the capitulum, and then you see the radial head. And here is the position of the transducer. This is how you place a transducer to see that view. Now, this is the most difficult component I'm trying to show you. If you guys are interested in the examination of the radial nerve and see that the nerve dividing into two components, what you're looking at here is the brachialis muscle, and here is a radial nerve coming and dividing into two branches right by the lateral epicondyle. One of the branch goes deep into the supinator and appears on the posterior aspect of the elbow as the posterior interosseous nerve, and the other is a superficial branch which is coming across straight under the brachioradialis. The way you want to examine it, you want to take your transducer and start scanning right at the point of the lateral epicondyle and a little bit proximal to the elbow, and scan anteriorly and laterally to see this. Here you're seeing, and in this image, here you're seeing the radial nerve which has already divided into two components, superficial and deep. If I show you a video clip on this and I show you how I'm scanning, I will show you this video and the scanning animation, you will see this component going deep into the two parts of muscle. This will staying up superficial up to here, so we'll be crossing under the brachioradialis. This is the most difficult examination of the elbow, but with practice you could do it. Here is the video clip. Watch this video clip and watch this scanning. You see this? This is the you see this? This is the deep component which is passing through the supinator, and here is the superficial which is staying deep to the brachioradialis. And here is the nerve which is posterior interosseous going between the two heads of the supinator muscle. And here is your scanning technique.